Okay, Bruce, I'm going to just get us started here, so you can go ahead.
I'm Bruce Carruthers, and I want to welcome everybody to our session on why this election is so important for veterans this year. Our coordinator is Jeff Roy, who's having some difficulty getting into the meeting, and hopefully will be joining us shortly. So I'm taking his place to welcome you to introductions. We have on our panel me, and I think everybody's published a bio, but I'm a member of the steering committee of Veterans for Peace Save Our VA campaign, and also on the steering committee for the Veterans Healthcare Policy Institute. I'm a Vietnam veteran and a retired VA employee. We also have Arliss Harum, who's on our steering committee. She is also a Vietnam veteran, a nurse in Vietnam, and has long been involved in the Save Our VA campaign. She lives in the Minneapolis area. Then we have Susan Gordon, who probably all of you know, who, in addition to being on the Save Our VA steering committee, is also a founding member of the Veterans Healthcare Policy Institute, an author and a journalist who has published several books, many of them on the VA, is an investigative reporter and often writes articles for national publications on the VA. And then we have Jeff Roy, who's a coordinator of our Save the VA program, a Marine Vietnam veteran, and a person who's been extremely involved in veterans issues and spent a lot of his career as a community organizer. So these people will be speaking later, and I'm just going to give initially what I want to do is just talk about how important the VA healthcare system or the Veterans Health Administration is to not just the veterans, but to the nation's healthcare system. Few Americans and not many veterans appreciate the scope and the breadth of what VHA does. So we have some slides to look at, and I only have a few minutes. I'll be brief on this. There's a lot more than what I can say. But the first slide just says the value of VHA to veterans and U.S. healthcare system. So can we go to the next slide, please? Okay, the VHA has four missions: healthcare, education, research, and national preparedness. So it's not just a healthcare provider. It has responsibilities far beyond that. Next slide, please. We talk about healthcare, which is what most veterans will be familiar with. Just to give you some idea of the scope and the breadth of what the VA does for healthcare, you can see on the slide here, it treats 9 million veterans at over 1,300 facilities in the country. That includes medical centers, vet centers, outpatient clinics, nursing home care clinics, and the like. It says 170 medical centers. I think there are actually 172. There are rehabilitation centers, nursing homes, vet centers. It is the largest integrated healthcare system in the U.S. And while many people might have predicted that the VA would lose patients because of Afghanistan and Iraq and the PACT Act, which expanded the eligibility for veterans receiving treatment from exposure to burn pits, traumatic brain injuries, and the like, VA's patient load has actually increased since 2001. Excuse me. Next slide, please. Okay. Another issue that we can discuss here is patient satisfaction. The VA ends up getting a lot of bad press because it's easy to pick on the VA. But in fact, according to a recent Medicare survey, VA hospitals outperform non-VA hospitals on all 10 core patient satisfaction metrics, including overall hospital rating, communication with doctors, communication about medications, and willing to recommend the hospital to other veterans. In April of 2024, the VA Department of Veterans Affairs announced that veteran trust in VA outpatient care increased to 91.8%, up from 85.6% in 2018, the first year that this survey was done. And on a personal note, I received my health care from the VA Asheville. I've had 2 surgeries there recently, and I received excellent care. Next is education. And this is one thing I don't think a lot of people in this country realize. The VA has teaching agreements with 1,800 educational institutions all across the country. More than 70% of the nation's doctors have received training in the VA. So when you see a physician, it's very likely that that physician has had at least some of his or her training in the VA. Besides that, the VA also trains nurses, psychologists, social workers, physical therapists, occupational therapists, and many other healthcare workers, cooperative agreements with various schools and training institutions. The American Association of Medical Colleges recently told Congress that the VA is an irreplaceable component of U.S. medical education and research. Next slide, please. The VA also is a research powerhouse, and that's something I'm sure very few people are aware of. It is second only to the National Institutes of Health in the scope and impact of its research. To mention just a few of its innovations, the VA developed the shingles vaccine, the nicotine patch, the implantable cardiac pacemaker, and the use of beta blockers to reduce mortality rates after surgery. VA research benefits the American public as well as benefiting veterans. A good example here is the VA's Million Veteran Program. It will be the largest study, long-term study of conditions that individuals suffer because VA patients, unlike patients in the private sector, don't go from one insurance plan to another plan. They tend to be lifetime VA patients, so they can be tracked over a long time. And the information that comes from this will be extremely valuable, not just to veterans, but to the entire healthcare community. And last, the VA does extensive research on prosthetics device to assist disabled veterans. And again, this benefits all Americans. Next slide. Next slide, please. Next slide is national preparedness. Another thing that a lot of people are not aware of. VHA often responds in emergencies, in cases of hurricanes, tornadoes, wildfires, earthquakes, and even volcanic eruptions, to ensure that local residents can access health care during emergencies. I worked for the VA for 30 years in 10 different locations, and we'd always do emergency preparedness exercises where there would be an emergency plan in the community and VA would accept patients from the community. It's an integral part of what's going on now, especially in more rural areas. Some 700 rural hospitals have closed in the last decade, and many more are in jeopardy of closing. So often, the VA is the only facility in the area that can provide intensive care. I'm not sure many people appreciate that, veterans or non-veterans, but it's an essential role. If we have an emergency, the VA is the backup to private hospitals when they're overwhelmed. And during COVID, the VA provided these services. They sent nurses to other hospitals. They provided all kinds of services for the general public. The point I'm really trying to make here, is kind of in summary, is that it's unrecognized and unappreciated how valuable VHA is to the American public, not just the veterans, but to the American public in general. It's research, and as I said, it's invaluable to medical education of doctors. Many VA hospitals have, in fact, VA hospitals have affiliations with medical schools. 99% of medical schools have strong affiliations with them. The medical schools benefit, the patients benefit because VA patients have access to the high quality of care provided in a medical school, and VA patients can be treated there and can be trained there. So it's a very important coordination that assists not only veterans, but assists the medical schools and assists Americans in general. Just a few examples of what the VA does, and then I'll be off because my time is running out. If it weren't for the VA, we'd have no idea what Agent Orange effects were. I have service connection because of Agent Orange. If you didn't have the VA Agent Orange registry, we'd have no idea what had happened. The same thing will happen to traumatic brain injuries, to toxic exposure, to military sexual trauma. If the VA is not around to track these people and treat veterans, if it goes to the private sector, all of this will disappear. So It's in the interest of everybody. It's in the interest of every veteran to support the VA. Thank you, and I'll give up my time now and give it over to Susan Gordon.
Hi, so I'm Suzanne Gordon, and I'm a healthcare researcher and writer and journalist. I've written 23 books, and 3 of them are about veteran healthcare. And I'm currently writing another one about about Kenneth Kaiser, who was the man who transformed the VA into the incredible healthcare system it is today. And, as Bruce said, you've probably heard a lot of bad news, and you maybe have had, if people are enrolled in VA healthcare, they may have had a bad experience, but that's because it's a human system and it's the largest healthcare system in the country. But from my point of view, and I'm not a veteran, as I said, a healthcare researcher in journalism, the VA delivers. Actually, I would argue the VA is the only healthcare system in our country. It's not only national, it not only delivers integrated and comprehensive care, but it's the only system that actually does health care, because we have a dysfunctional medical disease treatment system that doesn't do very well at preventing disease or even often caring for people with diseases and difficult conditions. But the VA delivers medical care. As Bruce said, it does teaching, research, and national preparedness, but it does way more. It addresses what we call social determinants of health. VA has legal programs, homelessness programs, mental health care. I would argue it's the only healthcare system in America, because as many people know, our healthcare system our mental health system is primarily jails and prisons. And even if you're really wealthy, you can't get very good mental health care. And it deals with economic issues, psychosocial issues, and if veterans need to be retrained, they can get vocational rehabilitation programs. So it's a healthcare system. And I think it's really important for folks to understand the difference between medical treatment system, which is what we mostly have, and a real healthcare system. And I would argue that not only does it deliver for veterans, and if I would direct people, and I'll put it in the chat, but I can't talk and do the chat at the same time. I will direct people to a number of studies that have shown how stellar the quality of care is at the VA compared to the private sector. And I can say, as a non-veteran and somebody who's for 78 years been cared for or not in the private sector, nobody does integrated care like the VA. Nobody integrates mental health care, nutrition, social work into primary care clinics. Every VA primary clinic has mental health professionals attached to its social workers. In the city that I live in San Francisco, UCSF, which is an affiliate of the VA but hasn't learned from the VA, has a primary care of 28,000 patients. They have 1 social worker. In the VA, they might have 3 or 4 for 1,000 patients. So I think that it's really important to understand that the VA, as Bruce said, doesn't only care for veterans and serve these other missions, but it's also, I think, a model for what healthcare could be like in America if we had a universal healthcare system. And my belief is that the slogan shouldn't be Medicare for all, because Medicare is only an insurance payer. It should be VA for all. And by that, I don't mean that 330 million Americans descend on 170 VA medical centers, but that you expand VA eligibility to all veterans and even their families, and then you use VA stellar models of care as a template for what we should all be getting in healthcare, and we should get profit and private equity and so forth out of healthcare. And the fact that VA works so well, the fact that, you know, vast majorities of veterans who go to the VA want it to be improved and expanded, not dismantled, attests to the strength of this government-run program, which is precisely why you have a privatization movement. You have a privatization movement because of two things. One is ideological, and that is that in our country, we are not allowed to have a government socialized medicine program that works, and the VA does work. And so folks like the Koch brothers or the sole remaining Koch brother and the dark money billionaires who are ideologically committed to taking public money and putting it into private coffers, they can't bear that, you know, something like, I don't know, I can't remember what the budget is, 300 billion or something like that. And in healthcare, it's probably like something like 100 billion or whatever it is going to pay for a public system, employees who are on salary and so forth. They can't bear that. And they want that pot of gold. And then there's the healthcare industry, the pharmaceutical industry that also wants that money. And so they have waged war against the VA. The form that this war takes is currently the VA Mission Act that was passed, sadly, by many Democrats in 2018. And it set up something called the Veterans Community Care Program, VCCP, which is administered by two private insurance companies, third-party administrators, Optum. And if anybody wants to know how Optum is doing, check out United Healthcare Optum and see what they're up to. And another insurance company based in Arizona, run by a pal of John McCain, of the late John McCain, called TriWest. And these insurance companies have been paid billions and billions of dollars, over $100 billion. I think it's closer to it. I'm not sure, but for the past since 2018, to set up a parallel private sector system to which veterans can go if they satisfy a certain eligibility requirements. That is that they have to wait 20 days or 28 days for a mental health primary care specialty appointment and have to drive more than 30 minutes or 60 minutes to these respective appointments. Right now, over 40% of veterans are getting care in this private sector system, and the VA is functioning as an insurance company to pay for their care. This Veterans Community Care Program was set up. It was the brainchild of the Koch brothers funded Concerned Veterans for America. And it was set up to cannibalize the VA budget and destroy the VA healthcare system. And if we are not careful and we do not deal with this hemorrhaging patient who's come into our emergency room, they will have succeeded in destroying the most successful healthcare system in America. And I think the only healthcare system in America. Right now, something, as I said, 40% of VA patients are getting care in the Veterans Community Care Program. The VA is paying money to over 1.7 million healthcare providers who are experts at not delivering the care that they bill for. They are experts in what's called upcoding, which is a form, at least if it was Medicare, of criminal fraud and abuse that can bear criminal fines and penalties, which have not been imposed on these private sector providers in this Veterans Community Care Program. The rationale for setting up the VCCP was to deliver more timely, better, high quality, conveniently located care. All the studies show that the private sector delivers care with many more delays. It is of lower quality, and it is more expensive, and it is not more conveniently located. J.D. Vance, who, as you know, is running with Trump, recently told folks in Northampton, Massachusetts, that the Veterans Community Care Program and the Mission Act is designed to help rural veterans get good care. There is no care in rural America, and I will put in the link in the chat, a study that Veterans Healthcare Policy Institute just recently did on this myth that the Veterans Community Care Program is serving rural Americans. Rural Americans actually have much greater access to care in the VA and than they do in the private sector, because like there ain't no care there in rural America. There's an extraordinary terrible healthcare crisis in rural America that is getting not better but worse. And the VA should be considered a partner in solving that crisis. But if the Republicans succeed at killing the VA, it won't be able to do that. The reason why the VA can help solve the rural healthcare crisis in rural America is because paying for rural healthcare for many rural Americans who have very serious chronic conditions is a money-losing proposition for a healthcare system that's run, that's driven by the goal of enhancing profit, not delivering care. The VA is a not-for-profit system, public system, whose mission is to enhance care and deliver high-quality care, usually at lower cost, but it is also, even if the costs are higher, it will deliver that care. So we know that, as I said, care is of lower quality, higher cost, with more delays and less conveniently located, and yet Republicans keep pushing this myth that private sector care is better for veterans. What private sector care is better at doing is killing the VA. We now have, the VA is now confronting, because of the community care, the hemorrhaging of patients to community care, which is more expensive, facing between a $25 and $40 billion deficit. It is a disaster in the making. And if this is not reversed, it will really kill the VA. Recently, Kenneth Kaiser, who was the Undersecretary for Health in 1994 through 1994 to 1999, chaired something called the Red Team Executive Panel that did a report that was commissioned by VA about the consequences and costs of the community care program. And they showed the hemorrhaging of funds, the hemorrhaging of patients, the poor quality care. Veterans need to know, for example, that if they see a private sector doctor under the community care program, the doctor will be happy to take taxpayer money to pay for that visit, but the doctor is not required to know anything about veterans' complex health conditions, as are VA clinicians. And that's why, nor are the private sector providers required to coordinate care. And that's why one study showed that of the 500,000 veterans who were taken on ambulance rides, either to a VA emergency room or a private sector emergency room, the veterans who were taken to private sector emergency rooms were twice as likely to die in the first 28 days. And the cost was 21% higher than veterans who were twice as likely to live if they went to a VA ER. And yet 30% of VA's clinical care dollars are going to pay for veterans to go to private sector ERs where they're more likely to die. And one of the things the Red Team report suggested is stop sending vets to these private sector emergency rooms, or if they do go to a private sector emergency rooms, get them back to the VA so the VA can save their lives. if you're a veteran and you have prostate cancer, and what's called clinically insignificant prostate cancer, where the standard for care is watchful waiting, and you go to the private sector, you are more likely, I think I'm sorry, I don't have the stats at my fingertips, way, way more likely to be recommended to have a radical prostatectomy or invasive radiation treatment than watchful waiting. And it's like not a good idea to cut out your prostate if you're gonna, die of something else. It's like really not a good idea. And private sector oncologists have a huge incentive to do surgery, do invasive radiation, because it's financial, it's a fee-for-service system. They also have a huge financial incentive to give you chemotherapy if you don't need it, because they mark up chemo drugs between 116 and 600%. So when you go to an oncologist and they tell you in the private sector, that you need chemo for insignificant prostate cancer, guess why they're telling you that? Same thing with orthopedics. They're much more likely to give you knee replacement, shoulder replacement, hip replacement than VA doctor. And VA could save probably 23 billion or more a year by simply keeping mental health patients, orthopedic patients, oncology patients, and ER. So there are many solutions. Now, I'm running out of time, and I really want to say that I am very excited suddenly, as opposed to being despondent, about this election. Why am I excited? Because if Harris and Walz win, we have a chance to pressure them to reverse the course that Biden and his VA leaders refuse to reverse, which is the course of outsourcing care to the private sector, destroying VA's human resources infrastructure, and finally hiring more staff that are needed to take care of veteran patients who are incredibly complex, and fixing VA infrastructure so those staff who are taking care of patients have exam rooms to see them in, and rooms where they can do billing and coding and so forth. And I am really honored to be part of this amazing group of veterans as a non-veteran that make up the VFP Save Our VA campaign. There is no other group in the country of veterans that are as reliable, as steadfast, and get it like your amazing members get it and are on the case. I mean, this is a tiny group of 7. I don't know. I never served in the military, so I don't know what the metaphor is, but kind of holding the hill and so forth, and just refusing to back down and keeping at it. We need your help. We need folks who don't go to the VA even to just write a letter to Congress. I mean, I think Bruce and Arliss and Jeff are gonna say this again, but if Trump wins, it's a disaster in so many ways, but it's the VA will be gone. And if Harris and Walz win, it will be very important to assure that they get the right person to be Secretary of the Department of Veterans Affairs, Undersecretary for Health, Undersecretary for Benefits. We know that the current secretary, who is, in my view, a disaster, and Undersecretary will be leaving, good riddance. And we need good people, and we have to pressure them if we're going to get good people. We need them to implement the Red Team report's recommendations, like, the day they get into the White House. We have a patient who's in the emergency room bleeding out, and we have to do damage control, and then we have to stabilize the patient, and then we have to address the fundamental problem that brought the patient into the ER in the first place. And I think that fundamental problem is failure to understand what a jewel we have in the VA healthcare system. failure to get veterans to defend it, even if, and to argue for expanding it. I know many VFP members have other than honorable discharges and so forth. All that should be taken away, and they should be able to go to the VA. And we can do it if we get people in the White House and we put pressure on them, and we can expand the VA, and we can use it as a model for healthcare for all. So folks like me, who have also served their country for decades, fighting American war, can get the kind of healthcare we all deserve. We can afford it, we can do it, and we need to act now. Thank you so much.
You're
You
You're
need to
muted.
unmute.
Sorry, I thought I had unmuted. Bruce and Suzanne have made some of the points that I plan to open with, which is one of them. The VA is important to not just veterans who use the VA, but all veterans and all Americans. And it really is, for the reasons that Bruce explained to you. And as far as being a real healthcare system, I live in Minneapolis. In June, I was down in Milwaukee. I had to go to the ER on a Thursday night. And the following Wednesday, I was back home, and my primary care provider called me to have me come in for a follow-up appointment for that VA, for that outside emergency visit. That's healthcare. And that's when the VA system is working well. Suzanne also mentioned what SOVA does, and it's really only SOVA and VHPI. We're it. We're really the only two groups and small groups that we are in the US that are focused on trying to save the VA from being privatized. She already alluded to how small we are, but we do some things. One of the things we do is education. Presentations at the VFP convention is one of them. We're more than willing to come to your VFP meeting or to any local meetings, if Healthcare for All folks, other veterans groups, anybody that you want. We're very happy to do a Zoom presentation at any time. Contact us at sovamail@yahoo.com, and we'll get back to you and we can set something up. We do presentations locally, but there's not so many of us, so we don't do many in-person ones. Aside from education, trying to influence Congress is our other, and it is our major activity. We meet members of Congress, or rather their staff. Last October, we went to DC and we met with 33 members of Congress. Most of them were Veterans Affairs Committee members. We're able to access them because we are veterans, and as members of the Veterans Affairs Committees, we are their constituents. We like to meet other members of Congress at all, but we need help from other people. We need a constituent to join those meetings with us. If you're willing to help us out by meeting your representative or your senator, again, email us at sovamail@yahoo.com, and we'll set it up and we'll lead the meeting. We maintain ongoing contact with the staff. The staff are really important people in all that, in all this. You're not going to have an ongoing relationship most of the time with the actual member, but the staff is the one who gives the information to their senator or their representative. And having an ongoing relationship and sending them the things that Suzanne writes, the analysis, the articles, asking them questions, interacting with them, helps us be able to influence them and provide them information. Recently, Jeff and I happen to both have Ilhan Omar as our rep. And we've been meeting with her local staff. First time was about 5 years ago. she recently invited Representative Takano, who is ranking member on the House Veterans Affairs Committee, to Minneapolis and invited us as 2 members of a 25-person panel to discuss the PACT Act and influence to discuss the PACT Act while he was here. So these relationships are important. And so if anybody is willing to let us know that you'd be willing to meet your rep or your senator, we'll gladly help you set it up and attend a meeting with you. The other thing we do to influence Congress is ask people to send letters to their members. Every 3 weeks, we send out an update. It comes in your email. It's short, a page and a half that's broken up, so it's not even quite that long. It's focused on whatever's before Congress at the time, an issue, a bill, whatever is going on. It's focused on that. Includes some information about that and links to learning more about that issue. And then includes a letter to your members of Congress about that issue. It's easy to do. You just click on it, fill in your name. We ask you to add a few words at the beginning of the letter saying that you're a veteran, you get VA care, you're family of a veteran, whatever. But personalized letters attract more attention than a strictly form letter does. We have over 1,100 people that have sent letters for us, but we need a lot more. The more letters that a member of Congress gets on a topic or on an issue, the more attention they pay to it. So we like having multiple people from the same area, but people who are 1 or 2 people sending to their rep, it also allows us to get information to those reps. So we'd like you to go to the SOVA website, and there's a link in the chat room, and sign up to get the update. It takes about a minute every 3 weeks if you can send a letter for us and help us out. We are small, and VHPI and SOVA are the only ones in the country doing it, so we really need your help. There's also a link in the chat to send a letter to your member of Congress about the Red Team report that Suzanne was talking about. We really want it to be implemented. It stresses the dangers that the VA is in and clearly states from 6 experts that the VA is at a crisis point, that the funding cannot continue to go out the door to the private sector and have the VA survive. So we ask you to go to that link and send a letter to your member of Congress. And I think that's all I have for right now. And so thank you. And we can go to the Q&A.
Jeff, are you on?
I am.
Okay.
Sorry for the delay. I've had some technical problems. My name is Jeff Roy. I'm a Marine Corps veteran of the Vietnam War, and I have just been able to, while I've had problems here, listen to what I think is a very good presentation. What I wanted to note to people is if you, I think you had a notice sent to you that if you have questions, to please enter those questions into the chat. And at this point, now the panelists have finished their presentations, we can pose questions to them. And at this particular point, let me check and see if we have any specific questions.
Jeff, you do have one hand up.
I do
Dr.
see.
T.
Yes, I do see.
Oh,
And I've got to look into chat.
I don't think his question's in the chat. I think he just raised his hand.
Oh, okay.
So bring him up here.
Hi, family. I've been involved with all y'all for a few years now. Me and Harvey down here in Harmony used to stand on the corner. Anyway, I'm having a difficulty having my issues resolved to be able to have my care done in VA hospitals. I would have to drive to Minneapolis. For me is 150 miles, or I drive to the VA hospital, and lots of stuff they won't do there in Toma, so they would have me go all the way to Madison, Wisconsin. My biggest thing is trying to have my procedures done in a VA facility. How do we get things done so that our VA facilities have the equipment, doctors and stuff to be able to give us the services we require from a VA facility instead of outsourcing to like local hospitals or whatever. Is there any good way for us to address that situation other than the letters? I write to FinStat once a week, and I've got a whole line of form letters that I'm getting back, mostly saying that he's working with it, but the way it is, the private sector can give us the best care in a timely fashion. And so that's kind of my question to bring up for all y'all.
Doc, I really appreciate, and good to see you again.
Thanks.
Yeah, I wonder, Bruce Arliss, do you want to?
I'd be happy to, you want me
You
to?
want to, Suzanne? Go ahead.
Yeah, I mean, if Bruce or Arliss, I'd be happy to defer to them, but, and perhaps they have something to say, but, and I just want to ask Doc a question. You live, where do you live? Are you live in rural Minnesota?
Yeah, he lives in Harmony in the southeast of Minnesota.
Is that, and I'm assuming that's a rural area?
Very rural.
Okay, so if you live in a rural America, you're going to have to drive for care, right? Particularly specialist care, particularly procedures. You're going to have to drive. I mean, it would be very unusual. And I think the problem is that it's, the question veterans have to ask themselves is what kind of care are they getting? And the VA will give you the best care, and it's worth the drive, and it's worth the wait, and the wait is usually less than the private sector. Many people drive. If they're rich, they fly, like the Saudi princes who fly from Saudi Arabia, to the Mayo Clinic or MD Anderson Cancer Center and spend $16,000 for a 1-hour consultation with an oncologist. The VA will usually pay for people to drive or fly to getting a procedure or an appointment if they have to travel. And rural Americans, it just have to travel. There is no way around it. And Doc, I think you should look at the chat and see the paper. I think that, the best thing you can do if you're a veteran is to insist that you go to the VA, that it's worth the wait and it's worth the drive. Now, obviously, if it's a question of, getting an antibiotic for something like a urinary tract infection or something like that, that's different. But if you have something serious, I think you should drive to the VA. I would if I could, and for example, let me give you an example. Kaiser Permanente. If you're a member of Kaiser Permanente and you live in Redding, California, or if you live in Santa Rosa, California, that's 2 hours, and Redding is 5 hours, and you need brain surgery, you're going to have to drive to Redwood City, California, because that's where they do brain surgery, and they do a lot of brain surgeries. And so you should want, Arliss can talk more about this because she's a healthcare professional. You actually want to drive to a place where people are doing hundreds, thousands of these operations a year, not just once. So I know that that's sometimes hard because it's inconvenient, it's a pain, but sometimes you just kind of have to drive to places if you're having a procedure, because that's the only way that you can get it safely from people who do enough of them to say that they know what they're doing. I don't know, Arliss.
I just want to let you guys know we're past time. We can go for another 6 minutes, but if people can make things briefer, maybe we can get to all the questions. Sorry, Suzanne.
I'm sorry, it was very long-winded and please forgive me.
I appreciate what you got to say. For me, it's 60 miles to La Crosse to be part of get into my provider. And then it's 150 miles or whatever it is, 200 miles to Madison, to the VA hospital. And the people in the VA are reluctant to sign me up to go to Madison.
Well, you just have to insist.
David, I'm sorry, I'm going to interrupt again because we do have 3 other people
Right,
with
we
hands.
can't-
All right,
So
that's
maybe-
do a-
I pass. Thank you so much.
There's Eric.
Yeah, you had a hand up quickly.
Dan? Are you-
No, it's good to see everybody, and I just wanted to give a little horror story about the so-called choice that you're supposed to have with the mission statement. At one point, I had to go for a psych evaluation, and they sent me to outside, even though I refused. I said, "Don't I have a choice?" And basically, I didn't, and that caused me to have a nervous breakdown, and I went into a deep depression and had to be sent to the Tacoma American Lakes Special Program, VIP program for post-traumatic stress and moral injury for 5 weeks, and that was during COVID period. So eventually that's helped me a lot, but I still have, still my post-traumatic stress is still there. There are sometimes when they tried to send me out for something else, when I finally became 100% disabled veteran based because I had a skin cancer related to Agent Orange, which ends up being 100%. And I had to find that out for myself because my VSO officer wasn't even prepared to answer the questions I needed and to file for that for me. But I finally got that and said, no, I will not go to an outside doctor. I will only go to the VA. And they finally, I said, I'm supposed to have a choice. They finally made sure that I was getting my treatments at the VA hospital. So I go 3 times a week. Now, one thing, I also have injuries,
Dan,
with my
I'm sorry,
spine.
I'm going to be pushy here because I want to give other people a chance because we are over time.
But I wanted to ask, there's a specific question, and that has to do with TRICARE. I am sent out to a chiropractor and massage because the VA doesn't have it here. And that does, and I go once a month to that. So the question is where the idea that the VA does not have the facility to take care of a particular thing. They do send people out. Again, that's because they're not hiring people and putting them in there. And so how do we continue to advocate that we have these other specialties in the VA? And
Bruce?
Susan or anybody can answer that.
Bruce?
I could address that. The VA has long used outside sources. It's like I worked at the Erie VA hospital, and it didn't make sense to have some of the specialties. So we employed people on a fee basis. They came to the medical center and they provided services rather than having people sent outside to that. And that's a real solution. If the VA doesn't have enough patients to warrant hiring somebody, what we used to do was hire somebody on a fee basis. They would come to the hospital maybe 1 day a week, 1 afternoon a week, and they would provide treatment. the VA could go back to that. This issue of needing people from the private sector is something the VA has handled for a long time. It's not anything that's unusual. We just didn't send people out. And I want to make one more remark. I don't have much time about rural health care. If you look at the report that Suzanne posted, you will see what desperate shape rural health care is in this country and getting worse day by day. So there are people in Kansas, for example, who drive 45 miles to a pharmacy because there's nothing available. In the VA, you can get your prescription through the pharmacy. What we need to do is continue to lobby. We get maybe 200 people to sign a call to action, though we have over 1,000 people who are signed up. If 1,000 people would send these letters out to Congress, it would make a lot of difference. If more people would say, okay, if you want to have a Zoom call with my representative, my senator, or my congressman, I'll be on that call with you. We could be a lot more effective. We really need your help. And that's where it could make a difference if people are not passive, but they're active in assisting us in getting a hold of Congress and making Congress listen to, as veterans, what we want from the VA and what we want Congress to do to protect the VA. And so I'll turn it over back to Jeff to call on someone else.
Okay,
Eric,
Hello?
do we have time for Eric yet?
Actually, I was on before Eric.
Michael?
Yes.
Yeah.
Two quick things. Number one, I've been getting my care at the DCVA for about 25 years. I've been offered several times to go outside, and I have always refused, even though it will take a couple of weeks longer to get an appointment, because all my healthcare records are in one place with the VA, and I like that a lot. The second thing was what Jeff was just mentioning about Zoom calls with our representatives. Instead of doing that, meet with your representatives at your district offices when they're home for recess. That way you can get an appointment in person with the staffer there who specializes in vet issues, or maybe even the representative or the senator, him or herself. So that would be my suggestion. That would also not make it necessary for us to come to DC every year and spend a lot of money and time seeing 8 senators.
Michael, I appreciate your comments. Thank you. Anyone from the panel want to refer to that? If not, Eric?
Can you hear me?
Ken? Go ahead.
I just wanted to reinforce from personal experience. I'm in Maine and I'm 45 minutes from the Togus VA. The dental chief is wonderful, and he was not able to service me because he couldn't find the specialist oral surgeon he was trying to hire. So I ended up driving to Concord, New Hampshire, which is 4 hours away. And so that just backs up the statement that if the VA were strong out in the rural communities, this big, beautiful campus at the Togus VA, just sitting with empty positions that could be saving me 4 hours one way and 4 hours back. And this is just a statement, but the dental chief has been pulled away from being the dental chief. He is also the chief of staff and the dental chief. And there's going to be that push and pull. I've had horror stories in the outside provider. And so I just want to say that from now on, for reasons that were mentioned, keeping my records in the same place, for one, it's been hell trying to get multiple dentists out in the community to get my records in one place. But I think that there's a safety issue that I could really get into, but I won't. There's not enough time. And I just think that the VA can and always will be a bit safer for me. And I don't know. I had some questions, but I don't really want to take some time and leave some other people to talk.
Could I ask folks, I'm having trouble putting it in the chat, but I would really love it if Eric and other folks would reach out to me so I could help tell your stories, because we really need these stories. And my email is SG, like Suzanne Gordon, SG@SuzanneGordon.com. And I implore you to reach out to me. I'll try to get it in the chat. If somebody could put it in the chat, SG@SuzanneGordon.com. you know, one of the solutions to the problem, Eric, that you have is, if some of these medical centers, particularly in the Northwest and other areas of the country, there's fewer and fewer veterans. So one way you can keep these centers alive is to welcome non-veterans in the community or veterans' family members. They've done that at White River Junction in Vermont for mental health care. And that's one of the things that we at VHPI, and I believe I can say that SOVA would really support, is in rural areas. If you have, you know, I mean, if you're in Kearney County, I can't remember, you know, Colorado, or you know, and there's like 9 veterans there. I mean, the VA is not going to build you a facility for 9 veterans, most of whom are Vietnam veterans. But, you know, the VA can beef up a facility even in places where there's a declining veteran population. If veterans' family members and community members are welcomed into the VA, that should be piloted. It's one of the things that we recommend.
Really sorry, but the other workshop that has to start in 15 minutes needs to do their tech check.
Sure, I'm sorry.
They can't start their meeting until we close this one down. So I'm really sorry, but I'm gonna have to shut this down. But your email is in the chat. Give
Thank you.
people a second to get it. But I'm sorry, but it's not fair
No,
to
no,
the
you
next.
should. I'm
I
please
gotta
forgive me.
go. I gotta.
Excellent workshop, excellent workshop.
Thank
Thank
you,
you.
everybody. I'm
Thank you.
sorry
Bye,
I was
everyone.
really
No.
pushy.
Thank you, Ellen. You have to do what you have to do. Thanks.
Okay, bye-bye, everyone. See you in the next one.
Bye-bye.
Appreciate everyone that was on.